My name is Joseph Payne, and the intervention I've chosen is substance abuse. So let's get started. So for my abstract on substance abuse intervention, there are many different types of substance abuse interventions currently used in the United States. In my paper, I've included popular interventions, or the most common ones used today, and also ones that are new and up and coming. This paper also discusses the amount of people affected by the substance abuse issues or the opioid crisis, and areas that have more needs than others, such as rural compared to urban communities. So to start off with why I chose substance abuse interventions as my topic, is that I've currently worked in the substance abuse field for more than 5 years. I currently work at a hospital that contains a detox unit. It's a 7-day. I work in a admissions department, so I admit clients daily in Charleston, West Virginia. So I see that this is a growing problem, and that there are new intervention techniques that are going to be needed in the future, and that there are also some current ones that are helpful, but need help getting either marketed or a greater emphasis on this issue. To start off with, the definition of addiction has been defined as the complex disease that takes more than strong self-control to quit. The main types of addictions I witness daily at work include heroin and meth, which is common in West Virginia. So for those who maybe don't work in the substance abuse field or are curious about it, we hear of heroin daily in the news and across the nation, but what is it actually made up of? So it's an opiate drug that is diluted with either milk, starch, sugar, or some other substance, so that can be used intravenously, which is IV. Heroin can also be used by other methods, such as smoke or snorted. And a stat also provided in here that I found staggering was that there are more than 4.8 million Americans who have used heroin in their lifetime. So to give some statistical information on heroin use in America, heroin use was 19 times higher in clients who had used opioid prescriptions from 2013. This is from SAMHSA's website. The CDC also reported that in 2017, the amount of overdose deaths were higher in rural areas compared to urban communities, and the increased HIV and Hep C breakouts due to heroin's IV use. This is also can be related to meth use as well, being used IV. So the clients that I see daily at work, a large percentage of them do use IV, compared to using like smoke or snort, any other methods. Also, I provided a chart from the CDC's website, and it goes all the way up to 2013, but it shows the dramatic rate or increase in heroin-related overdose deaths, which ends up being a 286% increase. So, giving staggering information on the prevalence on this issue. So while conducting my research for the main interventions currently being used today, the modern day ones, the Federal Department of Health and Human Resources, the DHR, had put out 3 initiatives in 2015 to help battle the opioid crisis, or the epidemic. And these initiatives are still being implemented across the nation. So the first one being prescriber education, and the second being access to naloxone, which is pictured in this slide. That's the Narcan nasal spray. And naloxone is used to reverse an opiate drug overdose. It often takes more than 1 dose to recover an individual, depending on how much they've used. And the third one being access to medication-assisted treatment. Those include Suboxone, Subutex, and for meth users being methadone. So as I mentioned earlier, prescriber education was one of the main initiatives pushed by the federal DHR in order to battle the opioid crisis or epidemic. So currently there's a limited number of physicians who contain a waiver to prescribe buprenorphine naloxone. And increasing the amount of family care physicians in rural communities or in rural hospitals could help the substance abuse community battle this crisis and to help clients and their families in need. So to talk about intervention methods, medication-assisted treatment. This is commonly known for opioids. It's commonly known as Suboxone or Subutex. Suboxone is becoming the first choice for opioid replacement therapy. It can assist with the cravings and the thoughts of using heroin. And unlike heroin and meth on the street, it is controlled by medication. So either a clinic, you hear of Suboxone clinics commonly. They can control and to monitor clients who are currently using this to help them with their addiction. So to start off with some research I found on new interventions that are either in the process or starting to be used for substance abuse. Massage therapy was actually one that I stumbled across, and it's currently used to assist patients with chronic pain. It's currently used in the healthcare setting by cancer, surgery, and the general population to assist with chronic pain. And it's also approved by the Joint Commission. So in 2017, the Joint Commission released a new pain assessment standard that requires hospitals to offer non-drug methods for pain. And massage therapy is one of those mentioned. The increased monitoring of clients who are at risk for opiate addiction or have a past history of opiate abuse, this could be a great alternative for them to use for chronic pain. Another new intervention technique for substance abuse is acupuncture therapy. It's currently used to reduce stress for the general population. It can be used by therapists to assist substance abuse clients find enlightenment, staying off substances, and can be peaceful while also reducing stress. It can help clients find solitude and quietness even while they're surrounded by the stress that's going on in their daily lives. So one issue in the substance abuse field that I see every day is transportation. So for those clients who live in rural communities, such as I see clients from like Mingo areas, Logan, Boone, and those are related to like the Charleston area. Clients who live very far out from services for detox or rehab treatment. There is a current service or intervention available for this issue, and it's called Logisticare, and it's provided through Help for West Virginia, which is based in Charleston, and they provide a number of services. They can help sign patients up for temporary Medicaid if their Medicaid isn't active, so that way they can get access to treatment. But I deal with, I probably call them or they call me several times a day with a client who doesn't have reliable transportation or no transportation at all to get to treatment, such as in Charleston, to our facility. So they will actually help the client, once they're accepted into treatment, set them up for transportation services. And it's kind of like a taxi service in a way, but it's Medicaid funded, so the client doesn't have to pay anything for it. And it's I think it's a very beneficial service that's available, and many people don't know about it, and they should, working in the hospital setting. So one website that I found was beneficial for the substance abuse field was Substance Abuse and Mental Health Services Administration, which is SAMHSA.org. They accept private insurance, online counseling for increased privacy to clients, and online intensive outpatient therapy. And they're also accredited by the Joint Commission. I thought their website was easy to navigate, easy to find resources, and for those clients who want to keep private, not actually go to maybe an inpatient facility or rehab, could benefit from their services. So on this slide, I have my references that I've used to write my paper for interventions for substance abuse. I hope you enjoyed this video. Hope it was somewhat beneficial and helpful, and appreciate your time. Thanks for listening.